All right, very good. So good morning, everyone. Appreciate you all, joining and spending a couple minutes talking through our HR health checkup. So, kind of goes without saying that 2020 had all of us focusing on areas of our personal and professional lives that we otherwise, really might not have given much thought to or as much thought. Things like our own physical and mental health, that of our colleagues and coworkers, businesses and individual finances, certainly political decisions and discussions, childcare, education, and working remotely with our ever-present pets. So while that's not a picture of my cat, any of you who have spent any time with me on a Zoom call over the past couple months know that I could easily have 100 pictures just like that one. And understandably, the more routine aspects of managing your HR department may have gotten less attention than they deserved or frankly needed. And this can be particularly problematic if the health of your HR function was on the decline to begin with. While 2021 seems to be starting off where we still need to pay as much attention to those areas that you see here on the screen, we have been putting, in place a lot of benefits and plans and policies over the course of 2020 that now we can start to kind of regroup, take a breath, and hopefully look at more of the health of our HR department. So when I think of the overall health of an HR department or function, I tend to think of three main areas. I'm looking at efficiency, effectiveness, and compliance. Compliance being, are you following the rules as they relate to your industry and business makeup? So if you're FMLA eligible, are you familiar with those requirements and are they being administered consistently? A lot of times I'll see where members and non-members will say, oh, well, I'm over 50, I've got 75 employees, and we had somebody out on short-term disability, but I didn't give them FMLA or, something to that sort. So knowing how to administer those types of leaves. If you meet the requirement for an affirmative action plan, for example, is that being done on an annual basis? Are your positions appropriately classified as exempt and salaried or non-exempt and eligible for overtime? All of that falls under that category of compliance in my mind. Efficiency, here's where we start to look at things like, are your systems and processes designed and managed in a way that isn't an administrative burden? Are you taking advantage of all of the relevant technology tools that are at your disposal? Is PTO being tracked in an Excel spreadsheet rather than in your payroll and HR platform? Are you using a calendar invite or a calendar reminder for things like training and license renewals if they're applicable? Are you still emailing a big giant PDF of new hire paperwork that then needs to be printed and signed and scanned in back? There's a lot of ways that you can take advantage of the technology that's likely already at your disposal to increase that efficiency. And then effectiveness, here's where I start to look at the programs that you have in place and whether the programs themselves and the people responsible for managing them are accomplishing the department and company goals. Even, of course, under the normal circumstances, the scope of HR is broad and full of traps that anyone can kind of fall into from a compliance perspective. Often I'm talking to members, non-members who are departments of one or non-HR professionals who fill the role in addition to their core function. I had a call earlier this morning with the VP of Finance and HR. How often do we see that, VP of something and HR? HR, often gets tacked on to the back of another core type of function. Organizations, both large and small, are dealing with every aspect of HR that you see here on the screen. Might be to a varying degree and frequency, right? So some of our members may only hire 1 to 2 people in a year, or you may deal with a leave of absence request or the need for an accommodation every 2 years, which in some ways is even more problematic if there isn't a clear and understandable, and clearly defined process to follow. Policies, of course, become outdated. Forms don't get updated. Compensation inequities develop for states that are now starting to implement pay equity laws. All things to be aware of. And I've spoken to many business leaders who are worried by this reality, and many HR practitioners who really just don't know where to start to get a handle on the overall health of their HR department if it is in need of a little bit of support. So couple this, of course, with the changing regulations, change in administration, like Amy described last week, some of the new policies and areas of focus that we're likely to see. And it's good to take stock of where things currently stand. During my time, both as in-house HR and as an HR consultant, I've performed varying degrees of HR assessments to help organizations understand the current health of the department and to put in place healthier habits to get them where they need to be. Of course, no one loves the idea of going to the doctor or the prospect of an exam or a checkup or an audit or an assessment. Sometimes that makes people cringe. I see people on, on our Zoom calls where I'll say an audit or assessment, and they kind of tense up a little bit. But you do have a few options when you're looking at something along this line. The simplest I would say might be to conduct just a quick internal review of employee files and HR forms to confirm that your files are complete, they're current, they're accurate. You want to look for things like missing acknowledgement forms, incomplete documents. I-9s are a big one that you want to look at, make sure that they are completed fully and accurately, and take the appropriate steps to clean that up if you need to. In addition to your internal types of forms, make sure you're using the current W-4 form, current FMLA forms that are available, benefit plan docs, make sure you have your labor law posters up. A lot of this is kind of that checkbox type of compliance audit. A lot of these things do tend to expire or get updated without ever being, updated on the employer side. So this will give you a good jump, certainly, on your compliance health. I found that the easiest way to really accomplish this is just to get an employee census in an Excel doc, and then put your files and your types of documents that you expect to see across the top, and simply go down. And if you're a small enough employer where you've only got a handful of employees, go through all of them. If you're larger in size, you want to take a subsection, maybe 10 to 20% of your employee files to get a good understanding. As you go through, remember things like your I-9 retention requirements and purge those that no longer need to be kept. For those members who want to go into a little bit more detail, MEA does have available to them an HR checkup, and that's a call with our HR hotline and Jane. And sometimes having someone just simply ask you questions across all of the functional areas we saw on that previous page can help you uncover unknown blind spots, or simply to serve as a reminder of areas of need, especially if you're someone that doesn't have an HR background and you kind of got that, and HR type of job description, job title. With that additional dialogue and having that conversation, we really start to layer in more of that efficiency check alongside of purely just the compliance. Both of those options, the internal review and or the discussion with Jane, or if you couple them together, they can always be supplemented with the forms and tools that we have up on the MEA Member Tools website, as well as the policy review, document review that we do provide to our members each year. I think one of the easiest ways that I've seen to maintain awareness of changes in state and federal regulations that we provide is by signing up for CCH Answers Now, which you see that fourth bullet down on the slide here. That can easily be done through Member Tools. And we'll see on the next screen, I took a screenshot of just what that email looks like and the reason that I like it. So we'll circle back to that in just a second here. And then for those who may not either have the time to invest in doing an internal audit or are really looking for more of that comprehensive view, that comprehensive screening, MEA does offer what we call our total view assessment, which takes a look at HR and your HR function from a much wider lens. In addition to reviewing all of the documents, forms, and policies, our team's going to take the time to speak with HR, speak with executive leadership, management, supervisors, and that's really designed to get a complete sense of how HR operates in practice and the top to bottom understanding of and support for that function. We're also going to take a look at the available technology use. So typically I find that organizations can rather quickly and easily improve their efficiency simply by taking advantage of things that are already available to them. So employee self-service through their payroll providers, a quick hit one, electronic onboarding, online enrollment for benefits. More often than not, some level of this type of technology is already available at either no cost or maybe just a slight increase. That's kind of easily outweighed by the additional efficiency that it brings in. So once we start to do all of that, that really brings a solid perspective on all three areas of that HR health, right? Compliance, efficiency of operations, and effectiveness of policies and practice. Oftentimes it's through those conversations with management and supervisors that we see particular areas of need that are discovered. While HR senior leaders may think that supervisors are well equipped and have the knowledge and tools necessary to avoid inherent risk and to be, effective in their management, that may not always be the case. So processes sometimes get lost in translation. Sometimes they're not followed because they're too cumbersome, or frankly, they're just completely ignored. So having that conversation with that outside party kind of takes all of that into a safe space. You can imagine if you were to go to your supervisors, and some of them are going to be more outspoken than others, but if you go to the majority of your supervisors and managers and ask them how things are going, they're probably going to tell you it's great. But having that ability to kind of share in a safe and confidential nature with an outside party, oftentimes we do uncover more of those concerns and those nuanced conversations that come out. I told you we'd take a look at the CCH Answers Now email. So this is the email. It's a daily email. The thing I like about it is you can quickly get a sense of whether or not it's going to apply to you. So you can see the second half there, the state employment law tracker. All of the states are in all caps. So you can quickly take a scan of this every morning. If there's a state up there that relates to where you have operations, where you have employees, take another look, click on the link. It'll take you through to that information. Otherwise, if none of the states apply to you, file it away, archive it. You can always come back to it. But it's just a really good, quick and easy way to keep on top of all things compliance. What I have here on the screen is a sample of the recruitment selection and onboarding section of MEA's assessment report. So one of the questions I often get asked by members and non-members, frankly, is, if they're considering an assessment, can we only look at a particular area, right? Can we only look at X area? We feel as though we're good in everything else. The reason why I have the image here on the screen is to show that, with very limited exception, I do advise against that. If you notice some of the areas listed, you'll see checkboxes dealing with things like ADA compliance, Americans with Disability, FLSA status, compensation, drug screens, employee assessments. So although this section is really focused on the recruitment selection and onboarding, we're already having to dive into areas like compensation, job description, employee development, and more. So in order to get that full, true, and accurate picture, you really do need to look at all of the areas underneath HR. The only exception why I said, I advise against looking at specific areas with limited exception, the only exception would possibly be if you're solely doing that file audit that we started the conversation with. Even then, if you're finding things like a number of the documents are missing, they're outdated, they're not completed properly, you really need to go back and uncover the root cause of why that's happening. Could be poor manager training or understanding of an onboarding or performance management process. But you really do need to start peeling back those layers to understand why those files are the way they are and put in place the remedies to address them. So at a minimum, I always suggest an annual health screening, right? So that quick hit compliance checklist type of thing. I would consider that to be, like I said, the document file review, starting the conversation with, looking through to make sure we have all of those posters up that we need to have and some of the more kind of checkbox type things. From there, depending on your level of concern or your need for more of that personal trainer to work with to get you into shape with all things, HR related, we can certainly support you looking across the entire function. Like I said, this is just one section of that full report that we do provide with the 12-month kind of action plan on the back end to address those areas. But really, a number of different solutions for assessing your health. The health of your HR department. Like all things that we have here at MEA, we can really meet you where your need is. So if you want to just have a conversation around what that file audit should look like, send over an Excel spreadsheet, make sure you're hitting all of the primary targets, certainly happy to do that. We've got Jane and our team for that HR checkup conversation, and then the more comprehensive HR audit here for anybody that may have need or desire for something like that. So with that, happy to answer any questions, Kevin, that might have come through, or Amy, if you have any additional perspective you'd like to share on that as well.
That was great, Matt. We had a couple that came in that we've emailed people. If anyone is interested in any of the programs Matt talked about, feel free to reach out to Matt, and he can set you up with Jane for the audit conversation or with Littleview. And Someone did ask a question about where to sign up for the CCH Answers Now. That is on the members site under, it is under
About the middle
quick
tile is
links.
going to be the
I think
quick
it's under
links.
quick links. Yeah. And
Yep.
quick links has survey information and others. So every month or so, we do run a member event that kind of walks you through all the different tools. So feel free to sign up for that as well. But thank
Yep.
you very much. Is Amy, are you doing a quick thing or?